Good afternoon, everyone. Again, my name is Tim Kennedy. I'm the manager of ComplyTrack Field Services for Wolters Kluwer Law and Business. Joining me today from Wolters Kluwer is Casey O'Brien, our product manager for our ComplyTrack Risk Assessment Solutions. Lee McMillan from our marketing department for our MediReg's ComplyTrack suite. Before we get started with today's webinar, I just had a few quick housekeeping items that I'd like to address. First off, for questions and answers sessions, please use the Q&A menu item on your menu bar if you have questions, and you can feel free to type your questions throughout the presentation, and we will also provide time after the presentation for Q&A. In addition, you can also download a copy of today's presentation by clicking on the icon in the upper right-hand corner. You'll see 3 pieces of paper which you can use to download today's presentation and simply follow those instructions. If you're having difficulty seeing the full screen or the full slide, simply hit your F5 key on your keyboard. That will put you in the full screen mode. You also could have an icon in the lower right-hand corner that will put you into full screen mode. One final note regarding continuing education credit. After today's presentation, we will mail out 2 hours, and you will also be mailed to anyone who logged into today's presentation. At this time, I'd like to introduce Chris Auerhan, a director at Meditology Services, LLC. Chris is our guest speaker today, and he's a seasoned professional in the healthcare industry. He has collaborated with a wide variety of organizations, including providers, payers, vendors, exchanges, and clearinghouses in simplifying compliance and evaluating security risks. Chris's commitment to this industry and his own growth in knowledge and experience is demonstrated through his presentations and white papers on issues around information security breaches, medical device security, and streamlined risk assessments for meaningful use. Since 2008, Chris led the development of the Common Security Framework at the HITRUST Alliance, a healthcare industry consortium focused on security, privacy, and compliance issues. Since its release, the Common Security Framework has become the most widely adopted information security and compliance framework for the healthcare industry. Prior to joining HITRUST, Chris served in healthcare advisory practice for the PricewaterhouseCoopers. At this time, I'd like to turn over the presentation to Chris Auerhan. Thank you, Chris.
Yep, thanks, Tim. Today, what we wanted to talk about was remediation of risks following a risk assessment. And one of the reasons why I wanted to talk about this in conjunction with Wolters Kluwer was that, there's a lot of focus today, particularly from a regulatory perspective, on conducting a risk assessment and identifying the organization's risks, but not much about actually what you do after you conduct that risk assessment. How do you take the information that you've gathered and turn it into an actionable plan and a strategy for the organization? So today we're going to talk a little bit about the regulatory background and requirements for remediation and risk management. Then we'll go into developing a plan, prioritizing the actions of your plan, and then managing the remediation over the course of the plan, and then we'll end with some Q&A. And we'll actually also, I'll take a pause throughout the presentation for any questions before moving on to the next section. So from a regulatory perspective, the 2 things that I point to from a healthcare industry perspective is HIPAA and meaningful use. And HIPAA obviously has been around for quite some time now, and organizations have been expected to address the requirements of HIPAA since it was released. And from again a risk assessment perspective, it's been pretty clear in that organizations, as part of their compliance with the HIPAA security rule, need to do a risk assessment to identify the threats and the vulnerabilities and potential issues with breaches of PHI or unauthorized uses or disclosures of PHI. But there's also the risk management piece that comes after the risk assessment, and this is a required item for organizations. And basically it states that organizations need to implement the security measures sufficient to reduce risks and vulnerabilities to a reasonable and appropriate level again, to protect PHI from unauthorized uses, disclosures, maintain the availability, integrity of PHI, et cetera. More recently, meaningful use, the Stage 1 requirements similarly require a risk assessment be conducted by healthcare organizations, providers, payers that are eligible for meaningful use incentive dollars. But it also does actually require a management piece in conjunction with the risk analysis. So I have the text up here of the meaningful use rule, and again, basically it says that the organization, after identifying its risks, has a plan in place to manage and address those risks to a reasonable and appropriate level, and it points back to the HIPAA security rule. And there's been a lot of questions that I've received and discussion about, what actually is required from a remediation perspective for meaningful use. And, while I don't claim that even from a HIPAA perspective, you need to address all of the risks that you have identified from, a HIPAA risk assessment or any other type of audit that the organization has done, you need to at least have a plan in place, and that plan needs to have some, progress that you've demonstrated towards fixing those items. It can't just be a plan that you've documented and then, put in a filing cabinet and forgot about. It needs to be something that you're actively doing. And again, you don't need to remediate everything, but you should be remediating the key items, the high-risk items that were identified from your risk assessment. So how do you develop a plan that is actionable, that can serve as a good guide, strategy for the organization, and help the organization identify what projects they're going to undertake this year, next year, so on, and then how do you manage that plan? And we'll talk about the development right now. A corrective action plan, has a number of objectives here. So, first and foremost, it can serve as a good way to identify all the gaps and weaknesses that you've identified for the organization. Most organizations have more than one assessment or audit or evaluation that they go through over the course of the year. So it's important to be able to bring the results of all those assessments into one consolidated list, one plan, whereby you don't have a lot of overlap or repeated risks and items that you need to be dealing with. You can bring those together into one plan and define a discrete list of things that the organization needs to be doing or should be doing to address its risks. The next objective would be to define tasks associated with each of those gaps or weaknesses. What are the specific, tactical things that the organization is going to do to address those risks? If you have a risk around your policies, then some of your tasks may be drafting new policies or defining a policy management program or a governance program around your policies. What are the specific items that the organization is going to be doing to address the weaknesses? The plan also can serve as a good way to prioritize what the organization is going to do. Typically, you're going to find that you're going to have more than you can do in 1 year or even 2 years, and so developing a corrective action plan can serve as a good means of developing a strategy for the organization and figuring out what needs to be done now versus what can be put off till next year, or what's going to span this year and next year because it's such a large project. And this leads into the next objective, which is budgeting. So you have a list of all the items that the organization needs to be addressing, remediating, and you have a strategic plan in place, a list of tasks that need to be done for each item, and then you can budget for each of those items and figure out, for each task or for each gap at a higher level, how much it's going to cost in terms of time and money, and then you can request budget or plan your budget accordingly. And then finally, the last two sort of go hand in hand here, which is to identify the roles and responsibilities associated with each task and with each weakness or gap at a higher level, and then identify the individuals who fit into those roles who will ultimately serve as the people responsible for implementing and, once it's implemented, executing that control going forward. Now, a plan can contain a number of different items, and what I have here is a list of recommendations based on some guidance from HHS CMS with their Plan of Action and Milestones program. And these are, again, things that I have that they recommend and that I have found to be successful in terms of developing a plan and the things that I need to think about in developing a plan of remediation. The first item here, just to walk through each of these things, the identifier should serve as basically a unique way to identify that this is a new gap or what the gap is. And the identifier can actually serve more than just a purpose of being a unique ID, a chain of numbers or letters. It can actually capture data about the gap itself. So something that I tend to do when I develop weakness identifiers and develop this plan is associate or list out what the system or what the process that is associated with this gap is in the identifier itself. So you know that this gap is dealing with this process or system X or multiple systems to provide more information on what it is you're actually remediating or trying to fix. Also, what's good to capture in the identifier is the point in time in which the gap was identified. So you can capture the year and the quarter or the month in which you identified the gap, so that over time and for trending you can see how long a gap has been open and in progress, or if you have things closed, you can maintain a full list of all the gaps that you've had and all the things that you've done to remediate those gaps, and you have a nice timeline of all of those items as well. The description is actually, I think, more important than people perhaps think it is, and really the key here is that you want to define something that's discrete and concise, that describes the issue that you're trying to fix. And one of the reasons why this is so important is that when you go into the actual execution of the plan and the management of the plan, it's very easy to lose sight of what it is you're actually trying to do and what you're trying to fix. And by having that very, again, concise description of what it is you're trying to address, what the weakness is, you can go back to that and sort of level set as you are going through the plan and making sure that people are on the right track and they're focusing on the right things. It's very easy to get off track or get sidetracked onto other things that are perhaps associated with this weakness, but not actually address the weakness. So again, this actually serves I think a very useful purpose once the plan is in progress. The next bullet here, the weakness source, is pretty self-explanatory. What assessment identified this weakness? Was it your risk assessment, a self-assessment, an internal audit, or an external assessment, or something for perhaps a compliance program that identified the source of the weakness? And again, this can help you identify if there's overlap from your audits. 3 or 4 of these assessments identified this one issue, or this just came out from one assessment, that then you can help to prioritize and focus things on the right items here. The point of contact, and actually you could actually also add a sub-bullet here. The point of contact is going to be the person that's overall responsible for remediating the item. And typically this is going to be at a manager or director level, not necessarily the person that will be executing the control or executing the remediation, but who will be managing the resources, who will be executing the remediation efforts and the control going forward. And then a sub-bullet you could have here, you could have some of those additional resources, the actual people that you'll be dealing with, or who will be writing the policies or implementing a technology that the point of contact will be managing. The resources required, this is something that gets back to my point about the objective of budgeting. And what you want to do here in terms of developing your plan and developing your strategy is identify for each of your tasks and rolling up to the weaknesses, what's the cost that you're going to be incurring here? What is going to be required to implement these items and execute these tasks? You want to think about this from both a money perspective, if you have to acquire new technologies or hire consultants, how much is that going to cost? And then also from a time perspective. And I like to think of it as a time perspective of FTEs. So is this half a person's time over the course of a week or 2 weeks, or is it 10 people over the course of two months or a year? Whatever it may be, being able to identify how many people you're going to need, and if it's internal people or external people, again, this can really help to feed into the budgeting that you'll end up doing, and once you develop your full plan here. The scheduled completion date and milestones are, again, key points from a management perspective once you have your plan in place. So it's not necessarily just enough to identify specific weaknesses and tasks, but you want to identify milestones along the way that you'll be working to and tracking to with completion dates there, so that you can get an understanding of 6 months in how well you're doing, if you're missing milestones or if you're on track. And then it also again provides a level down, a shorter term goals for the people that will be executing the remediation activities, and that a project manager can manage to make sure that you're demonstrating progress and you have successes along the way. Some of these projects that you may undertake, like if you're encrypting 500 laptops, that could be a 6-month, a year-long project, and so it's important to have those milestones defined along the way of identifying a vendor and rolling it out to a test group, and then rolling it out to group A, B, C, which will then cover your entire environment. Those things that you can again track to and demonstrate progress to. The weakness status, I have a few examples here of things that I'd like to track from a status perspective. Of course, whether or not the item is completed or not, or if it's ongoing, then what's the status of it from an ongoing perspective. Is it on track? Is it delayed? I also like to include if it's at risk of being delayed, or if there are issues that I've identified that could potentially impact me meeting a milestone or me meeting the completion date that we set forth. And these are good things, again, from a management and reporting perspective that will serve useful, which I'll talk about a little bit later here. And then finally, the weakness severity is something that hopefully has come out of your risk assessment, which is basically, is this weakness, is this gap something that's a high risk or a low risk or a moderate risk? And this will serve as a means of helping to prioritize the tasks that you're going to focus on, the weaknesses that you're going to focus on going forward. And here I have an example of one of the ComplyTrack components here, which is just an example of what some of the things that you would want to track as part of your corrective action plan. And you can see here that you have again someone that's assigned to it, the owner of the action item here, the key milestones along the way, and some dates for when those milestones should be completed and the progress of those milestones. And again, all of these would then roll up into a report or a high-level plan where you could see everything, all the work streams and all the people that are responsible for those work streams. So from a project management perspective, you can be successful in managing everything that you have to be doing here. And so next we'll go into prioritizing the remediation items, prioritizing the plan. But I wanted to again pause and see if there's any questions about developing a plan before I move on.
Chris, I don't believe there are questions at this particular time.
Okay, great. Thanks, Tim. So from a prioritization perspective, there's 3 things that I like to look at that actually in the HIPAA security role they call out in terms of looking at priorities for your plan and being able to identify, again, what you need to do now versus what you can put off till next year versus what's going to span maybe multiple years, as part of your plan. And these components are your risk. So what's the risk of the item that you're having to address? The capabilities of the organization. What is reasonable and appropriate for the organization? Is this something that's reasonable and appropriate to address? And then the cost, going back to, again, the time and the full-time employees that you're going to need, and the dollars that will be needed for, again, services or technologies to implement to address the item. From a risk perspective, in my time with HITRUST and still in advising HITRUST, we pull a lot of data from existing sources like the HHS list of breaches affecting 500 or more records, and a number of other sources like DB Protect and other companies that evaluate risks and provide reports on those breaches. I and HITRUST look through all those data sources, and what HITRUST has come up with is a list of basically 12 high-risk items for the healthcare industry, and this is something that we've tailored for the healthcare industry, though I think a lot of these apply across all industries from a risk perspective. But the point of this is to focus an organization's efforts on the items that are most likely to result in a breach. And hopefully the risk assessment itself did that for you, but again, if you're pulling from a number of different assessments and audits and reviews, they may cover a broader scope of items. So when we're coming up with our plan and prioritizing our plan, what we're going to do, you might as well be focusing on the high-risk items versus the medium or the low-risk items that don't present as much of a risk of experiencing a breach to the organization. And a good example of this, and the first bullet here on this list, is insecure, unauthorized use of removable media or laptops. If you look at the HHS data, a vast majority of the issues that have been posted there result from a USB device or an external hard drive or a laptop being lost or stolen, and it had some number of records on it, and it wasn't encrypted, and therefore there was a breach, and they had to report that and incur all the costs and headaches associated with that. So if you're an organization and you have this data source, then if you have an option of choosing between encrypting your laptops, encrypting your mobile devices versus doing something else, well, you might as well do the USB and the laptops because this presents the greatest risk to the organization. If you only have $1 to spend or 1 hour in a day to focus on something, it should be on your highest risk item, and that's the point. That's the objective of developing our priorities around risks, is figuring out, based on this list, and you can tailor it for your own organization, what are the things that we need to deal with first and foremost before we think about addressing anything else that's not a high-risk item. The other thing I had pointed to was the capabilities of the organization. And again, I'm taking a little bit of a focus on the healthcare industry here and leveraging some of the flexibility of the HIPAA security rule and doing what's reasonable and appropriate for the organization. But unfortunately, there's not a lot of definitive guidance out there around what is reasonable and appropriate for the organization, whether or not this is something that the organization actually needs to remediate and address as part of their plan, or it's something that perhaps they can go through risk acceptance for. And when we look at capabilities, I look at both the organization capability as a whole, looking more specifically at the size of that organization. And here I have some specific things that we would look at, like the number of licensed beds for a hospital or the number of covered lives for an insurer, or you may just look at the number of employees for a vendor or a third-party provider of services. To, again, get the understanding of what's the size of this organization, what's the overall risk or the inherent risk of the organization based on that size, and then also what's appropriate from a capabilities perspective. What's appropriate for a very large organization is not the same as what's appropriate for a small organization, and looking at the size of the organization is a good means of evaluating what is appropriate. And then from a system perspective, we like to look at the capabilities of the systems in question. So there's a very, again, difference in what is appropriate for an internal system that has one admin that has access to it versus an external-facing system that has hundreds of thousands of individuals accessing it. Those have very different capabilities, and they have very different risks, and therefore what is appropriate would differ for one system versus the other one. And again, looking at factors like the ones I have here, and there are others that an organization could define, can help you identify the capabilities that the organization should be exemplifying in identifying controls and addressing weaknesses. And then finally, I talk about costs as part of your priorities. And again, we think about it from both a time perspective and a money perspective. From a time perspective, we would look at what's the overall duration of the project or the task. How long is it going to take to write new policies or encrypt all the laptops? And then from an internal resources perspective versus an external resources perspective, how many people do you need? Is it internal staff of 4 people over the course of 3 months, or is it a combination of the two, or all consultants working over the course of those 2 or 3 months to write all the policies and approve them and so forth and so on? From a money perspective, you'd look at both technology and services. So do you need new licensing of new software? Do you need to purchase new hardware? And then what are the costs associated with those? And both a upfront cost and recurring costs. And then the same is true from a services perspective. If, again, you're bringing in outside resources, consultants, what's the cost of those consultants over the course of the project or per hour basis? or even, again, new staff if you're hiring new internal resources, what are the costs associated with those, and all of those can then feed into my next point here, which is the budgeting perspective. So you can identify exactly all the full list of items that you want to address as part of your remediation plan. You have the costs associated with each of those items, and then considering the risks and the capabilities of the organization, your priorities, and say that if I want to address all of my high-risk items, it's going to cost me X number of dollars and Y number of hours of man hours, and I need 2 or 3 new staff, or I need 2 or 3 consultants full time to work on these items, or I need another $100,000-$200,000 in budget. And again, this can serve as a great way of developing your strategy, developing your roadmap for the organization, going to senior leadership and requesting the budget or the increase in budget or the increase in resources based on real hard data that you'll end up executing in the year ahead. And just as a quick example of what I'm talking about from a priorities perspective, I took two of the high-risk areas that we've identified, so security governance and then access control. And then from an organization perspective here, I have, again, a small organization, a medium organization, and a large organization. And that gets back to what are the capabilities of the organization and what's appropriate for the different sizes of organizations. In this case, we say that a small organization can suffice with just a designated representative for the security program, whereas a large organization should have a CISO and a steering committee that sets the strategy and approves high-risk items or high-profile items and guides the organization over the course of the year, 2 years, 3 years ahead. From a system perspective, same idea. In this case, we're looking at access control, and again, if you have an internal application with only a few people, then a username and a password should be sufficient from an access control perspective. If we look at a larger system with remote access or external access, well then maybe it's more appropriate that you have 2-factor authentication in there. You have your password and a token or a software certificate or something to that effect to provide that additional level of security here. And then we bring in the cost. So here I just have some estimates about what the cost would be for, again, from an organization perspective and then a system perspective. If we look at a small organization, assigning a designated representative for the security program, that may be 500 hours of an existing person's time each year that would be dedicated to overseeing the security program of a small organization. From a medium organization, bringing in a CISO, maybe that's a new role, and therefore it's going to be $125,000 of salary for that CISO over the course of a year. And then for the steering committee, it would be $1,600 in consulting services to identify charter and membership for the committee, and then 32 hours of the committee's time over the course of a year, and meeting and addressing these items and providing guidance and feedback, things like that. And the same is true from an access control perspective. 2-factor authentication may require $30,000 in purchasing new hardware and software and consulting services to implement the solution, or if it's just a strong username and password, then maybe $8,000 in consulting services to reconfigure the systems and write a policy and communicate out to employees, things like that. And then what we can do, and this is where it really ties back into a budgeting perspective and something that can be taken to management, is we can show that for each of these items and each of the items that we want to do, it's where the organization is today, and that would be the dark bar here on the graph. They're at a rating of 1, a maturity rating of 1, and for the cost of $125,000 or $8,000, $30,000, we can move to a higher maturity rating. So you can show that by spending this money over the course of this year, we'll increase the maturity of the organization in this area, in this domain. And the same is true for access control. And eventually you could, for a full plan, you would be able to bring it out and show the whole maturity of the organization's program over time and the costs associated with achieving that maturity. And again, all this is coming back to prioritizing as well. So we can say that for $125,000, we can go from a 1 to a 3 maturity, or for $8,000, we can go to from a 1 to a 2, and maybe that's what's appropriate. Maybe that's what management is accepting for the first year, or what's appropriate for the organization considering the capabilities. And again, this is a way to demonstrate that through a maturity curve here. One thing I did want to touch on real quickly is that risk acceptance is an option for organizations under both meaningful use and for HIPAA. It's perfectly fine for those addressable items to not have a control in place for those items. And the important thing to note, though, is that you need to have documentation behind that risk acceptance. It's not just enough to say, I've identified this risk and I'm going to accept it, but you should have some sort of record of acceptance and some sort of approval of that acceptance, so that when this item comes up again next year when you get assessed, you can point back and say that we've already identified this risk and accepted it. Or if worst case scenario, you get audited by OCR, you have the documentation to prove that you've identified the risks and you've gone through the appropriate steps and the appropriate due diligence to address the risk, accept the risk, because it's not appropriate, or it's cost prohibitive, or it's not really a high risk for the organization. And again, I'll move on to managing the remediation efforts, but before I move on to that, I wanted to just pause again and see if there's any questions about prioritizing the plan and prioritizing the efforts.
Chris, we don't have any specific questions pertaining to this section. However, I do have a question that I'd like to throw out there. We've got a lot of compliance professionals on the line, and I'm wondering if you could describe, in your experience, how you have seen the compliance officer's role in conducting the organization's security assessments. Have they played a big role? Have they worked closely with the Chief Information Security Office? How have you seen that structured? How have you seen other organizations accomplish that?
Yeah, that's a great question, and unfortunately, every organization is a bit different in how they approach that sort of thing, and I've experienced many of those differences, and there's no right or wrong way necessarily to approach it. But typically, you would see from a HIPAA or meaningful use perspective of doing a risk assessment, this would be something that would be led by the CISO and would ultimately or hopefully feed into a broader compliance program led by the Chief Compliance Officer, Director of Compliance, and I think part of what developing this plan and one of the points that I'm trying to get across is that organizations will go through many different compliance assessments and audits, and a risk assessment for HIPAA or meaningful use will probably reveal a lot of risks that other assessments will reveal as well. So the important thing is to continue to, over time, document the risks that you're identifying from the various audits, and then bring it into a consolidated plan of action, corrective action plans that the organization is going to execute. And it may overall be managed by the compliance office or the compliance officer. I've seen that definitely in many cases. And in the specific items associated with the risk assessment for HIPAA or meaningful use, or dealing specifically with security, then the point of contact may be the CISO, and he would have a team of resources responsible for executing that plan. At the same time, you may have perhaps a non-security related item or a privacy related item, and similarly, it can all roll up into the compliance office in this overarching plan of risks, and then you can assign responsibility for each of those items and manage all of the things that the organization needs to be doing from a security compliance or privacy perspective, or any other item that you're dealing with. So I think there's a lot of overlap, and there's a lot of opportunity to work together. I tend to see compliance though as being broader than security, but all the same concepts apply here as well.
Okay, great. Well, thank you for that. We do have one other question, Chris, and it's regarding securing laptops. I believe the question is, there are other mobile devices certainly out there these days, new types of phones which can download emails, files, etc. How are these phones and other mobile devices such as iPads being safeguarded, and do you have any specific examples of how these devices are being breached? The question coming from Sandra. I'm wondering if you could touch on that, please.
Yeah. So there's mobile devices, particularly the tablets, are a fairly new technology, a new market for organizations to react to. It's not uncommon, though, that particularly in, say, a provider setting, you would see a large adoption of iPads or other tablets is being used by physicians, nurses, etc. But the same controls apply, or the same requirements apply to those types of devices as do your laptops or your desktops. It's just a different means around controlling those devices, those tablets, versus controlling laptops. You have, in some cases, less capabilities in what you can and cannot do. What I typically see organizations do, and what seems to be the best approach currently, is that you can push everything to the cloud, fortunately, with tablets, so that you have an app on an iPad, and it's contained. All the actions that you would do are contained within that application, and there's authentication through that application, but there's no data stored locally on the devices. It's all stored remotely on the cloud, so that when that application closes and the authentication and the session ends, even if the device is lost, there's no harm, no foul, because the device wasn't storing anything associated with that application. Say an EHR application that allows you to access patient records. Everything can be stored remotely on the organization's central protected servers. From a mail perspective, it tends to be a little bit more difficult because most of the mail clients download things locally to the devices, and in some cases, if you have a Word document or a spreadsheet that has a bunch of patient records in it, then there certainly is a risk there. Again, fortunately, there tends to be a lot of options today from a control perspective, even with iPads, but your BlackBerries and other mobile devices as well, of being able to set policy on those devices. So you require a password just to unlock the device, and you require that they change the password every 60 days, and it's of so many characters of strength. And if in the event that it's lost or stolen, you even have the capability to wipe the device, or at least wipe the mail client of the device, so that if someone does break through the authentication requirements, again, they don't have access to anything because all the data has been removed. So again, sort of in summary, the requirements don't really differ for mobile devices, but the means of controlling them do. And I tend to see, again, a lot of organizations pushing to the cloud and not keeping anything locally, or setting policy to whereby you can protect the device in the event it's lost or stolen.
Okay. Thank you, Chris. At this time, there are no more questions, so I think we can continue.
Great. Thanks. So finally, I want to touch on, after developing your plan, prioritizing your plan, and coming up with your strategy, actually managing the plan. And this is something that I've seen a lot of organizations struggle with, because they don't assign someone dedicated to managing the plan, or the person dedicated to it is not a very good project manager, and so that they don't do a very good job of making sure that the plan is going according to plan. The objectives should be to again, identify the full list of items that you have to do and who is responsible for those items, track progress towards your tasks and milestones, and touch base with the people that are responsible for executing those items on a very regular basis, on a weekly or biweekly basis, and then also to identify and track issues. And this is going to be an important thing from a reporting perspective, is figuring out where the plan is going well, and then where the plan is not going so well, and if you need more resources, or if there's other problems and other people, senior management needs to get involved. You can identify those issues and react either before or in a very timely manner, rather than the issue spinning out of control, more or less. And how I typically see, or how I like to structure a project management effort around remediation, is to have executive management be the overall sponsor for the project. And again, this would be perhaps the CISO or the compliance officer or director, or even again for from a privacy perspective, it may be the privacy officer or some other VP or C-level executive who has a stake and stake in the execution of the remediation plan and addressing the risks. And then you would have a project manager or project manager that would report directly to the project sponsor, to senior leadership, and then under the project manager, you would have your organization managers and directors and the team leaders who would then have resources under them that would be executing many of the items as part of the plan. These are the people that understand, say, the process or the technology very well, and they're the ones that then should be writing the procedures or implementing the encryption solution on your laptops, so forth, so on. And you typically, I don't have this represented here, but you'd also see a direct reporting line from the org managers and team leaders up to executive management, and that gives the project manager an indirect means of influencing those organization managers and team leads. I found that sometimes you don't have the influence you need to as a project manager to get progress going or get focus from your organization managers and team leaders and things like that, and that's when you can raise it up to executive management, and then they obviously have much more influence and oversight over these people, and that's how you can sometimes get things done a little quicker than butting heads with an organization manager or team leader, et cetera. From a monitoring and reporting perspective, I definitely recommend, if you are in a project management role, reporting status of the project to the project sponsor or a steering committee or anyone else from a senior leadership perspective on a very regular basis, at least at first. I think a biweekly basis is appropriate to highlight what's been done, what are the successes that you've experienced over the past week or 2 weeks, and then what are the issues, what are the new issues, what are the recurring issues that you're experiencing, and what's the risk associated with each of these issues. If you're working towards a tight deadline, is this something that's going to ultimately affect you meeting that deadline for the overall task or gap, or is it something that's just going to affect a deadline set for a milestone but may not actually impact the overall completion date for that particular task or gap, or is it just something that is self-contained in one activity, something that the sponsor needs to be aware of, but isn't something that they necessarily need to take action on to address. Also, from a progress perspective, and again, this is something where a more robust tool can be very useful in coming up with a dashboard of what are all the gaps that you're dealing with, what are all the tasks associated with each of those gaps, and what's the status of each of those items. Is it open? Is it closed? If it's open, is it at risk, or is everything on track, or is it delayed? And also from a milestone perspective, tracking if you've missed milestones, and then how badly have you missed that milestone? Is it something that you missed by a day, or did you miss it by a month? And is it something that's been delayed multiple times, or is it something that's only been delayed once? Those are very good metrics to be able to track and report back to management and the sponsor of the activities to, again, get an overall sense of how the project is going and where they can best serve in terms of focusing efforts, and if there's more resource needs, again, that's something that can be identified out of all this as well. And the important thing here is, again, to make sure that someone has responsibility for the program and that someone is continuing to track on a regular basis how things are being handled, how things are being remediated, and if things are being missed. Some of the keys to success that I have found are that you really want actually someone that has a lot of project management experience. You don't want to necessarily assign someone that doesn't have that PM experience. I think half if not more of these things are related to project management activities versus, say, security or compliance activities. Obviously, it's ideal if you can get a project manager that has security or compliance experience, because then you really get the best of both worlds. But if you have to choose one versus the other, I would suggest going for a strong project manager versus someone that has a strong security background. I think the second point here is, and this is really on my last slide, is again diligently monitoring progress of items and tracking issues and reporting progress to management and senior leadership so that they can again take action on items that they need to, and they can be aware of items that may eventually be a problem, or again if everything is going great, then they can be aware of that too, and congratulate the team on their hard work and efforts. And then I think, again, if you can leverage tools, technology to have some of those reporting dashboards or help manage workflows and assignment of tasks and responsibilities, you're going to be in that much of a better position. You can certainly, and I have done this through just, Excel worksheets and tables and things like that. But if you have, again, a good project manager, I'm sure they're going to want to use Microsoft Project or some other, project management tool. And even better if you have, GRC functionality where, again, you can identify specific tasks and associate those back with findings from past assessments and associate those with compliance requirements and then assign roles and responsibilities to those tasks. That will be, I think, the most robust solution and provide the most management over the project and over the individual tasks there. And then finally, a key component at the end, or a key task actually at the end of each gap should be to validate that the gap actually has been remediated. So more or less retesting that the control now is in place and it's operating, and whoever's responsible for it understands it and can explain it if the organization is audited or for the next assessment coming up. And you could have a specific task that validates this through internal resources or through a third party, or it could just be something that you do on a continuous basis. You have 2 assessments a year, and therefore it's going to, by virtue of doing those assessments, you will be rechecking these things. But again, it's important to check your work and make sure that that the things that you thought you had done were actually done, and people understand those things. And if you do, just to touch on the second bullet here on this slide, if you do bake in validation as part of your remediation effort, you need to just make sure that you aren't taking away resources from implementing or executing the controls or the remediation items to test something, or taking away their time just to test something, because obviously, again, that will impact the ability for them to meet milestones or meet deadlines, and it's more important that they are successful in implementing the remediation activities or the corrective actions rather than testing it, though testing is still important. And finally, continuous monitoring, and this is an idea of continuous assessment as well, and continuing to track the risks that the organization has over time and how well that the organization has remediated those items, or if there are recurring items that keep popping up through different audits or assessments. And again, this can provide trending over time and say that we continue to see this issue, and so this needs to be bumped up from a medium risk to a high risk, or as the organization changes and the capabilities and the profiles of the organization changes, so too do the expectations of what should be remediated, and perhaps it's time to dust off some of those things that you previously accepted or hadn't gotten to yet, and reevaluate the need to perhaps focus on those going forward, because things have changed, and of course things always do change. So it's important that this isn't a one-time effort of addressing all the items in the plan. This is something that, and I'm sure the compliance professionals can talk about, this is something that you're continuously dealing with through the course of a year and many years ahead. So it's important to maintain that mindset when you are developing and managing your plan. And with that, again, we'll, I think, turn it back over to see if there's any other questions for this last part or any part of the presentation.
Great. Thanks, Chris. At this time, if you have any specific questions, you can please use the Q&A menu bar to ask your question. At this time, Chris, there are not any questions in the queue, so we'll just pause for a moment to see if additional questions come in.
Okay, great.
Okay, it looks like there was a question that was about to be asked, but looks like we're starting to get a few in here. Give me 1 second, please. There was a question. There's a question asking if this presentation will be available after today. The answer is yes. We will post this on our website. And Lee, I don't know if you can give the specific URL of where that will be. That would be helpful.
Tomorrow morning, this presentation should be posted on mediregs.com/blog. If you just go to mediregs.com, there's a link to our community page. That's where you'll find the blog.
Chris, if you could please, we have an attendee that's looking to would like to take another look at slide number 7.
Okay.
Which is the example of the corrective action plan.
There we go.
And there wasn't a specific question. I don't know if the individual was just looking to grab a quick look, but see if there's other questions coming in. We've got a question coming in from James. Do you recommend that the entities use the HITRUST Common Security Framework?
So again, my full disclosure, I have worked with HITRUST for a long time now and still advise HITRUST, and I think that what HITRUST has from a healthcare perspective is a highly valuable tool for both managing compliance and also managing risk. They have tools available that allow organizations to conduct a risk assessment. It takes you, very straightforward or straight through, each of those high-risk items and specific questions and controls that you would want to ask or see in place to do your risk assessment for HIPAA or for meaningful use. And it also serves as a tool that can be more broadly used from a compliance perspective to evaluate full compliance against HIPAA or the many other standards and regulations that the Common Security Framework incorporates, like PCI or ISO or COBIT. So I think, again, it's from a HITRUST is focused mostly on the healthcare industry, though it can be more broadly used. But I think it is a valuable tool for conducting risk assessments. And if you get a report from HITRUST, it will have the startings of a corrective action plan. It will have all your discrete issues, if there were any, or gaps, if there were any. But then again, going forward from a remediation perspective, that tends to be where HITRUST stops, and then the experience and professionals of the HITRUST membership and participating organizations come into play in actually executing those plans.
And Chris, just wanted to comment, slide number 7 is a screenshot from the new ComplyTrack information security assessment management tool that Wolters Kluwer Law and Business will be providing in the coming months to chief information security officers as well as compliance professionals to help them manage their security assessments as well as the corrective action. So this is an example of a screenshot and what you would use in our workflow software. And just to touch on the Common Security Framework, the HITRUST CSF is actually embedded in our information security assessment management tool. So we take the robust content and controls that HITRUST has pulled together, and we've integrated that into our workflow software tool and give you a very robust tool to conduct your assessments, to disseminate the appropriate surveys, and the ability to analyze the results and to manage all the corrective action plans. And let's see, I think we might have one more question. There's a question coming in asking if this presentation is eligible for CEUs with AAPC. Lee, I'll have to defer to you on that particular question.
No, today's presentation was approved by HCCA for their CEB compliance credits. We'll actually be sending those out to everyone who attended the live meeting today about 2 or 3 hours after the session ends. Also, we do offer a number of webinars that do have AAPC CEUs, so just watch your inbox. We'll send out invites for those in the near future.
Great. Well, Chris, at this time there are no more questions. I want to thank you for taking the time today to present this information to our audience. And for those of you that are on the line and want to have this presentation as a handout, again, in the upper right-hand corner, you can download this information to your desktop. And as Lee indicated, there'll be a recorded session posted on mediregs.com/blog where you can review the information and the material once again. So thank you, everyone. This concludes our webinar. Everyone enjoy their afternoon. Thank you.
Thank you. This does conclude today's